Today we're talking about a common supplement that many seniors take without a second thought, yet it may quietly be harming your health, and I want to welcome you to the Ageless Golden Year channel as we explore this important topic together. When I speak with older adults in my clinic, and when I listen to the questions that appear so often in the senior zone of health discussions, I notice a recurring pattern. Many people assume that if something is labeled natural or over-the-counter, it must automatically be safe. And yet, health after 60 is a delicate balance. The body changes, the metabolism shifts, and many supplements behave very differently inside a senior system than they do in someone younger. So today, I want to unpack one of the most common and most misunderstood supplements, one that so many seniors take every day, and discuss why it may not be as harmless as it seems. Before we dive deeply, I want you to feel comfortable, relaxed, and open to learning. I always say that holistic health is not only about what we add to our routine, but also about what we choose not to take. And sometimes, choosing what not to consume is the very thing that protects your long-term well-being. If you find conversations like this helpful, gentle, science-based, and focused on longevity, please consider subscribing to Ageless Golden Year. It helps this community of wise, health-minded seniors grow. Now, let's begin with a question I often ask my patients. If I showed you a small bottle of pills and told you it could support your heart, or boost your energy, or protect your bones, would you think twice about taking it? Many seniors would say no. They would take it confidently. After all, the supplement industry has become part of everyday life. But behind that confidence lies a complicated landscape. The supplement I want to focus on today is calcium. And yes, I know, many of you may be surprised. Calcium is one of the most heavily promoted supplements for seniors, especially women. For decades, people were told that taking a calcium tablet every morning was the secret to preventing fractures, maintaining strong bones, and living independently. But in recent years, a growing body of research has shown that calcium supplements, particularly high-dose, isolated calcium carbonate tablets, can sometimes do more harm than good. Let me explain why. First, it's important to understand that calcium is not inherently dangerous. It is absolutely essential. Our bones, our muscles, our nerve function all depend on this mineral. But the way calcium enters and moves through the body matters deeply, and aging changes that process in profound ways. When calcium comes from food, such as tofu, small fish with bones, leafy greens, sesame seeds, and fermented dairy, the body absorbs it slowly, naturally, and in harmony with other nutrients. It mirrors the way our ancestors lived. In Japan, for example, many older adults get their calcium from foods like natto, sardines, and miso soup with tofu. The calcium is paired with vitamin K2, magnesium, and protein in natural proportions, and the body uses it smoothly. However, when calcium comes in the form of a single isolated tablet, especially a large 500 or 1,000 milligram pill, something very different happens. That pill dissolves quickly, flooding the bloodstream with a sudden spike of calcium. And for seniors, this rapid surge can create strain. Think of your bloodstream like a peaceful river. A sudden heavy rain hits and the river level rises quickly. The water flows chaotically, faster than the riverbanks can manage. This is similar to what happens when a large dose of calcium enters all at once. The body must decide, where does this calcium go? And if it cannot store it smoothly in bones, perhaps because hormones have changed, or vitamin D is low, or inflammation is present, it may deposit that extra calcium in places it does not belong. This is where the danger lies. One of the most concerning risks is arterial calcification, calcium building up in the arteries instead of the bones. For seniors, whose arteries may already be stiffened from age or inflammation, this added calcium can accelerate plaque formation. Some studies have found that seniors taking high-dose calcium supplements may increase their risk of heart attack or stroke. Not because calcium itself is harmful, but because the body struggles to direct it correctly. I remember a patient from my early years in clinical practice, a gentle 72-year-old woman named Aiko. She had been taking calcium supplements faithfully for over 15 years because she believed it was the key to avoiding osteoporosis. When she came to me, she was confused and frustrated. Despite all those supplements, her bone density test still showed decline. But at the same time, her heart scan revealed early calcification in one of her coronary arteries. I still remember the look on her face when she asked, "How can I be losing calcium in my bones, but gaining it in my arteries?" It's a common and heartbreaking question. The answer lies in nutrient imbalance. Without adequate vitamin D, magnesium, and especially vitamin K2, calcium does not know where to go. It becomes a wandering mineral, aimless, misplaced, and potentially harmful. This is one of the biggest misconceptions among seniors. Many believe that calcium alone strengthens bones, but the truth is more like a team sport. Bones require a coordinated effort. Vitamin D to absorb calcium, vitamin K2 to guide calcium into the bones and away from arteries, magnesium to stabilize the process, and protein to support bone building. Without these partners, calcium becomes confused. Another issue is digestive ability. After age 60, stomach acid often decreases. Calcium carbonate, the most common, inexpensive form of calcium supplement, requires strong stomach acid to break down. Seniors with low stomach acid may not absorb this form well at all, meaning the calcium remains unabsorbed and may cause constipation or interfere with medications. Speaking of medications, this is where many seniors find themselves in danger without realizing it. Calcium supplements can interact with blood pressure medications, thyroid medications, antibiotics, and even some heart rhythm drugs. And because seniors often take multiple prescriptions, the risks of interference grow higher. I think of another patient, an 81-year-old gentleman named Mr. Sato. He was taking thyroid medication and calcium supplements without spacing them apart. When his lab work showed abnormal thyroid levels, he couldn't understand why. But the calcium was binding to his medication in the gut, preventing proper absorption. Once we simply adjusted the timing, taking calcium several hours later, his levels returned to normal. Something so small made a huge difference. This is why I always caution seniors. Supplements are not innocent. They must be treated as seriously as medications. Now, does this mean calcium supplements are always harmful? Not necessarily. There are circumstances when they are appropriate, such as for individuals who truly cannot meet calcium needs through food, or who have medically documented deficiencies. But even then, the dosage, timing, and form matter. What I hope to help you understand today is not fear, but awareness. Awareness that your body after 60 is more sensitive. Awareness that calcium tablets are not the simple bone health insurance they were once advertised to be. And awareness that supporting your bones is a whole body strategy, not a tablet strategy. Let me shift for a moment and talk about the cultural perspective of bone health. In many Japanese communities, especially in rural areas where people live long, vibrant, active lives well into their 90s, bone strength is supported naturally. Daily walking, gentle squatting to sit on the floor, gardening, cooking, and community movement all keep bones stimulated. Bones respond to pressure, just as a tree grows stronger when wind brushes against it. When movement decreases, bones sense that they are not needed and they begin to thin. So instead of relying on a pill, these long-lived elders rely on lifestyle, foods rich in minerals, sunlight on the skin for vitamin D, fermented soy for vitamin K2, and consistent physical activity. One of the oldest women in a mountain village I visited would carry bundles of wood with her grandchildren. When I asked her secret to strong bones, she simply laughed and said, "My bones must work every day. They do not have time to become weak." Her words stayed with me for years, because they capture the simplicity and wisdom of holistic health. Now, some of you watching may say, "But Dr. Kenji, I have osteoporosis. I can't rely only on lifestyle." And I agree. It is important to treat real medical concerns seriously. But even for osteoporosis, the most effective strategies are often a combination of diet, strength training, vitamin D, and sometimes medication, not large daily calcium tablets taken without guidance. Let's explore the science a bit more deeply. Bones are not static. They are constantly remodeling. Osteoclasts break down old bone, osteoblasts build new bone. After age 50, the balance starts to shift, and bone loss accelerates, especially for women after menopause. Inflammation also plays a major role, because when the body is chronically inflamed, the signals for bone breakdown increase. This is why seniors with diabetes, chronic stress, poor sleep, or inflammatory diets often experience more rapid bone loss. So even if you take 1,000 milligrams of calcium per day, inflammation can override that effort. Think of it like trying to fill a bathtub while the drain is open. You can pour in more water, but the loss continues. Closing the drain, reducing inflammation, is just as important as adding water. This is where holistic health truly shines. The foods you eat, the amount of movement in your day, the quality of your sleep, the health of your gut, your stress levels, these things shape your bones far more than one supplement. Let me offer you a gentle and practical framework that I often share with seniors in my clinic. Instead of thinking, I must take calcium to protect my bones, try asking, how can I help my body use calcium wisely? The answer usually includes eating calcium-rich foods, improving vitamin D levels, including vitamin K2 sources, supporting gut health, reducing chronic inflammation, engaging in daily weight-bearing exercise, managing stress, ensuring sufficient protein intake. When these elements are aligned, your body becomes far more efficient at placing calcium where it belongs and keeping it away from where it does not. Now, let me continue with another story, because stories help us remember the lessons of health in a way that numbers and science alone cannot. There was a gentleman I once treated named Hiroshi. He was 68, cheerful, always smiling, but he struggled with frequent muscle cramps, fatigue, and occasional heart palpitations. He had been taking high-dose calcium tablets for almost a decade, believing it was the secret to staying strong as he aged. When we ran tests, his calcium in the blood was slightly elevated, but his magnesium was very low. I explained to him that magnesium acts as a calming mineral. It relaxes the muscles, stabilizes the heart rhythm, and works together with calcium like a yin and yang partnership. Too much calcium without enough magnesium creates tension inside the body, both literally and metaphorically. After we removed the calcium supplement and increased his magnesium intake through food and low-dose supplementation, his symptoms eased within weeks. I feel like my body is breathing again, he told me. Calcium supplements had not poisoned him, of course, but they had pushed his mineral balance out of harmony, something especially common among seniors. Another important point: many seniors have calcification in joints, shoulders, or spine that is mistaken for arthritis. Sometimes it is not inflammation of the joint, but calcium deposition in the soft tissues. High-dose calcium supplements can worsen this pattern. I also want to address a very common question I hear from older adults. But Dr. Kenji, what if I don't get enough calcium through my diet? The truth is that most people can reach adequate levels through food if they are intentional. A small bowl of yogurt, a serving of tofu, leafy greens, sesame seeds, sardines, almonds, and fortified foods can together provide a surprising amount of calcium. And when calcium comes in food form, it is absorbed in harmony with other nutrients. For those who absolutely need supplementation, I often recommend a smaller dose, split into 2 parts, and paired with vitamin D and vitamin K2 under medical supervision. And for seniors with kidney stones, heart disease, or digestive issues, calcium supplements should always be discussed with a physician before starting. The key is not to blindly follow old advice. Health after 60 requires precision, patience, and personalization. One of the things I love about guiding seniors is that they bring wisdom to the table, life experience, humility, and an openness to learning. When I explain the risks of calcium supplements, Most seniors respond not with fear, but with clarity. They say things like, I never knew, or I wish someone had told me earlier, or now this finally makes sense. And that's what I want this episode to be for you, a source of clarity, a gentle light to help you see your health choices more clearly. Before we move toward the practical strategies, I want to share a simple metaphor I often use in my speaking. Imagine that your bones are like a traditional Japanese bamboo forest. Bamboo becomes strong not because it is thick or heavy, but because it is flexible, nourished, and supported by its environment. The soil, the wind, the sunlight, the rainfall, everything works together. If you simply add fertilizer without caring for the soil or the roots, the bamboo will not thrive. In the same way, your bones require a whole ecosystem of health, not a single nutrient. Now let's talk about those practical lifestyle strategies that can replace or complement supplement use. One of the simplest and most effective practices is daily walking. Walking places gentle pressure on the bones of the legs, hips, and spine, stimulating bone-building cells. Just 20 to 30 minutes a day can make a difference. If you add light strength training or resistance bands 2 or 3 times a week, you support the upper body as well. Another powerful tool is sunlight. Vitamin D deficiency is extremely common in seniors. Without adequate vitamin D, calcium supplementation becomes nearly useless. A few minutes of morning sun on the skin, combined with foods like salmon, sardines, and mushrooms, helps maintain levels naturally. I also encourage seniors to include fermented foods rich in vitamin K2. Natto is the most famous, though I know its strong flavor is not for everyone. But cheese, particularly aged varieties, and certain fermented vegetables can also contribute. Vitamin K2 helps direct calcium into bones and away from arteries, a crucial factor for longevity. Then there is protein. Many seniors eat too little protein, which weakens bones because bone tissue is partly made of protein. A serving of fish, tofu, lentils, or lean meat, each meal can support bone strength in ways that calcium alone cannot. And of course, reducing chronic inflammation, sleeping well, managing stress, avoiding excess sugar or processed foods, creates a healthier internal environment for bone building. Holistic health is not complicated. It simply requires awareness, small consistent steps, and gentle curiosity about the body. Now, I want to close this episode with the same calm reassurance I give to my patients. If you have been taking calcium supplements for years, do not panic. The body is resilient. Your health is a journey, not a single moment. What matters is learning, adjusting, and choosing the path that supports your long-term well-being. If you're unsure whether you should continue taking calcium, speak with your doctor, ask for a bone density test, ask for a vitamin D test, ask about vitamin K2, ask about your arteries, ask whether there are alternatives that might be safer or more effective for you. Choosing health after 60 is an act of wisdom, not fear. And if this episode has helped you feel more empowered, more informed, or more connected to your own body, please consider liking this video and subscribing to the Ageless Golden Year channel. It helps us bring more gentle, science-based guidance to seniors around the world. Thank you for spending this time with me. May your bones remain strong, your heart remain open, and your journey toward longevity be filled with clarity, joy, and grace.